in.
Let's welcome them in. Welcome in, welcome in. Welcome to Do It for the Story.
I'm Morgan.
And I'm Stacey. And welcome back, folks.
For another episode.
If you're watching, you can see our setup has changed. The signature Do It for the Story couch is...
It's been demoted.
It's been moved upstairs to headquarters, my office.
Mm-hmm. We loved the couch. We loved the look. As far as the color, we didn't really love the look as far as the it was shiny.
We need to be cozier. We're tall. We're both 5'9".
We couldn't fit on the couch. I could never get
on
comfortable.
the couch. This is, and I will give it, this is not sponsored, but Crate and Barrel would love for you to reach out. Crate and Barrel lounge couch, cozy as hell.
So you take these pillows off that we have to just apply depth, as they say, to these videos. But you take these off. You can also take this back off. This is a twin bed.
It's a twin bed.
Okay. And I'm telling you, you could fit. This is a very comfortable twin bed. Let's put it that way. If you needed to have a cozy, you could have a spinner and a full-grown man.
It's very hard to watch a movie on this couch and not fall asleep.
Yeah.
But anyway, that's the couch. If you want it, Crate and Barrel lounge couch, we'll link it.
Yep, we will link it, and we will take all the sponsors.
Shout out to Kiki and for giving this suggestion on the couch.
Yeah, because now here we are. We're loving it, and it's the new DIFTS couch.
We are loving it. And we also changed up. We have little mic arms that are holding, just because we like talking with our hands. We're free. We're live. We can dance, move.
I am going to do a couple cartwheels later and have it be recorded.
Can't
I love
wait.
that.
Can't wait. So should we cheers and kick it off?
Let's kick it off.
Diffs.
Love that little clink. These are also the signature DIFTS glasses. Let us know if you want a signed glass. We will sign it and ship it to you.
We actually are not going to do that.
We're not going to do that. We don't have any. We don't have any merch.
But yeah, cheers. Tastes like victory.
I love that. Tastes like spring.
It does.
Ready for this season change, y'all. It's
You
here.
got your little spring flower shirt on.
I purposely wore. I'm going to push the mic away from you for 1 second.
Okay.
Go ahead and take that
chest.
in. Go ahead and take it in, because this is a little vintage top that I've loved for a long time. And I was like, you know what? Today's my spring day, and it's happening, and we're here for it.
And my top is inspired by this is recorded, so it won't be the live, but 2 days ago was International Women's Day. So empowered women. Mm-hmm. Shout out to Lily Mae, Carol Jackson Academy in Baltimore. Amanda Eby got me this shirt. You know who you are.
I'm obsessed, and I love the profile fire. I almost wore my Beyonce shirt with just like a similar vibe. So we would have been extreme twinning.
Yeah. So empowerment. We need that for this topic.
For today's episode, I was going to say, we should get into it. Why don't you start us off, just what we're talking about and why, and we'll get into it.
So I don't know what episode number it is, because truth be told, it hasn't been published yet when this has been recorded. But in a previous episode, we talk about how I have something, street name PCOS, but Polycystic Ovarian Syndrome. So today we're going to talk a little bit more about having Polycystic Ovarian Syndrome is my root cause of why I don't have infertility, but why I have fertility struggles, let's call it. Yeah. I need science to help me get pregnant. And if you didn't listen to that episode, or you don't remember, Polycystic Ovarian Syndrome, it is a hormonal disorder, and it impacts women of reproductive age, cisgendered women that have, I shouldn't even say cisgendered women, anyone that has a uterus or vagina.
Yeah.
And it is an endocrine disrupting disorder as well. So it causes hormone imbalances, metabolic issues. There's a laundry list of side effects and symptoms. So go listen to that previous episode for all of that. But the big one we're going to talk about today is how polycystic ovarian syndrome, when you have it, it causes lots of women, not all, the inability to ovulate on your own. So I don't ovulate regularly or sometimes at all. And so obviously if you're not ovulating, and if you went to sex ed, which probably didn't give you much information in high school, no egg coming out, can't meet any sperm to fertilize.
Correct.
No baby can be made.
Not in the traditional
in
form.
the traditional form. And in the fertility community, we don't like to say natural way.
Correct.
Because there are many ways to create a baby. And hey, it's 2024. If you're not on board with science, you can get the fuck out.
I'll say that. You can get the fuck out.
Seriously, though, not the podcast for you if you're one of those like, I don't believe in science and I don't know.
Or you know what? Keep listening and
Keep
end up
listening
being
and
on
get
our
educated.
journey. Keep listening and you welcome in. You will be on our journey and you will eventually be turned and you will totally believe in science.
Yeah. and maybe you'll just shut the fuck up at other times.
Anyway, let's get into it.
Where should we start?
So I just take the pressure off of you. I was thinking I'll kind of lead today and do some of the interviewing because this is, I know from our depth of conversations around this off camera, off mic, that I know some of it is triggering and want you to have as little of a lift as possible. So
Allyship.
I am an ally. Thank you. Thank you for that. Thank you for that. This is about me. And so I want to first, I was thinking to just slow it down and like, well, I shouldn't even say slow it down, but just paint the picture from the beginning of like, what is the first step? Okay. You know already because you have been diagnosed with PCOS. So you already knew that you would need to have fertility help most likely.
Right.
And so after, knowing that you have PCOS and when you all did decide, because I think that's a whole other conversation, like when you decided you wanted to actually go down this journey and do IVF and like, yes, we're going to go through this because you've seen others go through it.
Right.
So after you've decided that, then what's the first step? Like, I mean, literally, because if it was me and someone told me you need to use IVF, I wouldn't even know. I would assume like, do I ask my gynecologist for a referral? Like, where's the first step of even going down the IVF journey?
Yeah, starts with the gynecologist for sure. And they will, so the gynecologist actually can refer you, like you said, to a fertility clinic. And what they'll do is a couple different tests just to check, like, for me, it didn't matter that they knew I had PCOS and that was probably the root cause, but they still need to check like your uterus and make sure there's nothing else going on. So they'll do a couple initial tests, which I'm honestly not going to get into today.
No, we don't need to.
But they do a couple of those initial tests, blood work. They do an ultrasound, transvaginal ultrasound, and then they do, they literally will like shoot dye up into your uterus to see if there's any like blockages or issues.
Okay.
And then from there, it's also a combination of, okay, how long have you been trying to get pregnant? How long have you been off birth control, having unprotected sex, that kind of thing. Mm-hmm. And so especially age is a factor. So it's different, if you were 26, they'd be like, okay, maybe try a little bit longer, but I think maybe it's 6 months to a year or something after a certain age in your 30s.
Okay.
So once you go through those tests and they determine you do in fact have infertility issues, they then will say, yep, your options are, if you are a candidate and you don't have any other issues going on, for IVF, it starts with the egg retrieval.
So even though actually correct me if I'm wrong, because I think I know this. So you knew you had PCOS before you were like, okay, I need to start the IVF journey, right?
Yeah.
And so even though you already knew that, did you still have to be like tested, like you were saying?
Yeah, for insurance purposes.
Okay. And how long does that take?
And because not every woman that has PCOS, I mean, I think the majority does have issues with ovulating, but not every woman with PCOS can ovulate on their own.
Okay.
So yes, excuse me. So then you do have to go to the clinic, and so in my situation, they were like, "Great, you're a candidate." Told me I have a gorgeous uterus, which
I'm obsessed with that,
I
by the
said,
way. When you told me that, I was like, I love that.
and I put it all over my walls because that uterus is.
Yeah.
I'm kidding. I did not frame it, but
I mean, I just
knew?
I just
have
love
a gorgeous
the fact,
uterus.
Yeah, I mean, I'll take any compliments I can get. So the fact that that doctor told you you have a gorgeous uterus, obsessed.
I said, take a longer look. Stay up there.
Yeah. Do you need to get any other, young doctors in here that are learning? Does anyone else need to see a
That's
gorgeous
what I
uterus?
said. I said, let's go. Come on up in it.
Hey.
Oh, that sounded bad.
I love
really
that,
did not
actually.
mean that. But so, yes, so I was told, great, uterus looks good, no blockages. Yes, you're a candidate. You can move forward with the egg retrieval process. So that's what's next. And the egg retrieval process is literally what it sounds like, getting your eggs out so that then they can either fertilize them in a test tube together or petri dish, or well, no, that's what IVF is. So yes, that's what we're getting them out so that we can make embryos.
Yeah, and because you were doing, you were like right then and there, I have my partner, I'm ready to have a baby with this person. You were just immediately making embryos. It wasn't like, just a freezing of the eggs or like, let's go ahead and make the embryos, which is if you are with a partner and make embryos, that is statistically better than if someone freezes their eggs and then 10 years later is like, okay, I have these eggs on ice. Let's see if we can make embryos, correct? Yeah. Okay.
Yeah, because eggs, and good point. And it's like, do freeze your eggs if you don't, you want to have kids and you're worried about it and you have that privilege and access and money or benefits. But yes, because embryos are always better to have. You're a step closer to the process. Eggs can still be just like embryos. They grade them. Eggs can still not make it through the thaw. Like literally once they're frozen, and then they, just to see the actual grade of them. But so with the egg retrieval process, the first step before you're taking any drugs or anything is also they give you the option to do genetic testing.
Okay.
And I'm not even going to get into recent states and legislation, but Alabama, you can fuck all the way off.
Yeah.
That's all I'll say.
Yeah. So, yeah. And that, well, I'm sure it'll
That's
come
just
up.
all. I just had to get that off my chest.
For sure.
Because it was very timely during my journey. And so the genetic testing, and again, I will preface this with, I am very blessed to work for a company that does cover my fertility benefits.
Yeah.
My husband does not. So, we were really lucky in that regard, and covered my genetic testing. So what that did is just that's to help us get a leg up, to make sure we're not playing God here. We're not picking and choosing gender or anything like that. It was to make sure we're also not carriers for other things that sometimes the only way to help to weed out a disease that can be, fatal, or the only way to stop it from reoccurring is sometimes just to say, not this embryo. And it honestly, even if we weren't going to create embryo, because at that point, Joe and I were just going through the steps of, okay, one, if you have the benefit, we were like, you never take that for granted. So we also, in that step of the testing, were like, this is good for us to know, because I have known many friends who didn't know they were carriers for things or didn't have conditions, case in point, Morgan, until they actually gave birth. So like we were able to see, both of us have cancer on either side of the family. I mean, most people do. Like to see what carriers we were for that and other genetic things. I have ADHD. They even asked me about that.
Wow.
It was kind of crazy. And so it's not every disease. It's just, I don't know how they determine it. Let's call it the major ones.
Yeah.
Ones that they see could be issues as far as embryo making it as well.
Wow.
And so that is a part of the genetic testing too. It's not just about the diseases weeding out. It's that, so there's a genetic testing you do before you even create an embryo. So that's what we did first. Then once you go through that testing, then we got approved to get started with the egg retrieval. First step is obviously, yes, my doctor, my OBGYN, my gyno could give me recommendations of clinics, But, and again, you all know where we live. We're in Annapolis, Maryland. So we're in the DMV, DC metro area. And that is DC, Maryland, and Virginia for people who are confused. There's a lot of access here to amazing medical care. But still, even in an area where we are, there's still not many fertility clinics. So first step is you have to pick, but you can't just pick anywhere. It's not like commuting to work where I might say, I could commute 2 hours. You have to be thinking when you're picking your clinic, once I get into this process, there are days where I'm going to have to be at that clinic at like 7 a.m. to do monitoring like every day at certain phases of the process. Mm-hmm. So when you do have jobs and a life and it's DMV traffic, you do have to take into consideration.
Yeah, you didn't want to be having to drive into DC every day.
Yeah, I mean, okay, everybody that lives in the United States, if I say the name Johns Hopkins, you probably know it, right? Not far from me. I mean, we're only 30 minutes to Baltimore, but it's the traffic in the morning that's in an hour. It's access, blah, blah, blah. So you get it. So we're lucky, though, that there actually are a few clinics in the area. There are a lot of states where, you may have one in your area. Or not like the whole state, but seriously, there are some states where it's, again, the state I mentioned earlier, do a Google search. There's not a lot of options. Right. So once we got paired up with our clinic, the egg retrieval process starts with... it's basically, and just again, I'm not going to go into the details of you take this drug and you take that drug. I'm focusing more today on what I wish I knew or what I'm so glad that others gave me advice about that had been through the process themselves.
And I was going to insert the same thing to say, just so folks know, we're very aware that there are podcasts that are fully dedicated to childbirth, IVF, all these things. So we're not trying to, we know that there's information on what happens, but what I feel like is often not heard are the individual experiences and the West or the Eastern medicine or the other things that are helping you specifically. There's not a lot of information on that.
Yes.
And I also want to just validate for other people that are going through this experience and are having a hard time or have weird experiences throughout the process that they're not alone and it is not a rarity. And I think there's so many, I have so many friends that have had children. I know so many people that have had to do IVF and it's just not something. I also liken it to, truthfully, my health issues. There's so much of it that I don't really want to talk about unless I need to talk about.
Sure.
I'm not saying that I'm, in a place where I'm still harboring all of this stuff and I'm, yada, yada. That's why I'm pushing it down. No, I've already gone to the therapy. I've already done all the things, but it is triggering to talk about again. So it's not as if, you're walking up to your friends and being like, so tell me the truth about your IVF journey,
Right. And everyone is different. That's a great point. I personally, even before, so once it was, okay, you're approved, you can move forward with, doing the egg retrieval. First, I should say, once we were diagnosed with infertility, I actually wasn't working at a place that covered IVF. So me being the type A, high functioning woman that I am, made a target list of companies and I manifested, and one of those target companies reached out to me before I reached out to them.
Oh my God, I didn't know that.
Thank you. So it was a sign to me, but they had fertility benefits.
Yeah.
And I think it's only there are maybe 12 states in the US that require you by law, if you're a company that has, I think it's 60 or more employees, you have to include fertility benefits in your insurance. Maryland. We love Maryland is one of those states.
They're one of them. Nice.
My company that I work for now is not headquartered in Maryland, but luckily it's just, we have different, they just do it on their own. It's not one of the states that has to have it. So I should say we had this pause moment of, okay, we know this. Now we have to figure out, are we doing this out of pocket? And I mentioned the other episode, you're looking at $30,000 easy.
Minimum.
minimum. And so when you're in that mental phase of, okay, for me, knowing that I had PCOS and we were going to have to use science, it started to kind of fuck with me mentally of, why should I be doing this? Is this a sign? Also, like, do I want to I have been so blessed to be this able-bodied, healthy person my whole life. And it felt like it was me having to then, do these treatments as a healthy person that weren't medically necessary. You have these weird things. So I say that because I literally was going through therapy about having guilt that I was not the woman at home crying that I was going to have to do IVF and couldn't get pregnant naturally. And I'm not knocking on anybody. It was just for me, I felt like I had a leg up or something that I already knew that was going to be my destiny.
Yeah, I see. I can see that kind of that pain of you physically trying, because I feel like I don't know anyone that was like, we tried for 6 months and then we immediately went and got IVF. I feel like it's usually like they tried a year and then they went. And so thinking of my friends that were like, I know that year up until that year to 2 years was very hard for them. It was very hard to realize, yet again, I'm not pregnant, yet again, I'm pregnant. And then finally going to the appointment and knowing, yes, I highly recommend you doing IVF. And then realizing, okay, now that's another step in the journey that I can understand being really tough. So I see what you're saying about having the leg up, but I also want to just note for you that I appreciate you thinking that you have the leg up, but I think because, and saying like, I'm a healthy person and blah, blah, blah. And like, I get what you're saying, that you're healthy in that you've always been able to be really physical. You've never had to slow down in those physical ways,
right.
You've never had an issue getting out of a chair or something, but you have your entire life had PCOS and have been dealing with health issues and have been dealing with, since, your early 20s, acne, and now knowing anxiety, that it was PCOS, anxiety, and ADHD, all of those things that go with that. So like, yeah, you're healthy, but you're not.
Totally.
And I'm saying that to give you credit of like, you're in this position because you're not actually healthy.
Yeah. And I think a lot of women do that, right? Because there's not enough research in any women's health conditions like that. You just kind of then try to be glass half full.
And you have to be. And I think that is, from my experience, I think positivity and the outlook and where you're going to go, I think it makes a massive difference.
Yep.
And I shouldn't just say, I think, like I've been told by my therapist, I think that makes a huge difference and you should have that outlook. But I think now, knowing what we know and where we are, we can literally say, you're not actually a healthy person, but I appreciate that you have never been able to physically, that you've never been physically slowed down, technically.
Able-bodied.
But have you probably felt fatigue and anxiety and all the things
brain
that,
fog, anxiety my whole life, blah, 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 blah.
And I say that too, because I think there are so many people with disabilities out there or with health issues out there, however you feel comfortable calling it, myself included, that, it feels very strange, and you don't, because there are such degrees of disability, right? Mm-hmm. And like, when you think of you hear about your friend's mom who has MS and is like, in this horrible state, you don't want to act like I'm in that same bucket. And exactly. I get that. But at the same time, it is also hard as someone who physically looks like everything's fucking hunky-dory, and yet inside it isn't. And there's a lot of people that I think deal with that guilt, pressure, anxiety because of that, because there's a lot of us out there that look a lot better than we really are.
Yeah, totally. And
But anyway, back to you and the IVF. And, I also would really like to get into, okay, so we've got this step. We know that now you guys have decided we're going to do the egg retrieval.
Right.
You're going to do that. You're going to make the embryos. And so what's the actual, experience like? Talk to me about, okay, you finally now you're at a company that's doing it.
Yeah.
Okay, you're ready to actually do the IVF. Or to do the retrieval, excuse me. So what now is the process? Like, how long is it leading up to the literal retrieval?
It's about, I think it's, and I even had to Google it again because it just seems so much longer than what it is. But it's like 2 weeks all in. But in that 2 weeks, you're taking hormones. And so again, with the PCOS, I already have a hormonal disorder that my hormones are already out of whack. Mm-hmm. So adding in other hormones, it's just crazy time. But what the purpose of those hormones are to do, it's to stimulate your ovaries. So that way, one, it's really to stimulate them. So that way these medications are encouraging the growth of multiple follicles. So those fluid-filled sacs that are going to hold your eggs in your ovaries. And so each one of those sacs contains an egg. So when you're doing an egg retrieval, the goal is to get as many as possible. Fun fact, Joe and I refer to it as Operations Baker's Dozen.
I love that.
I really prefer to me, laughter is medicine. So like I have to add humor into things. And so you're taking these medications, and some of these are oral, most of these are injection. Some are just like a little pen injection that's like, okay, not a big deal in your stomach, but these are also going in your stomach and your abdomen. And some of them, it's a nice big old needle going in there, and you're doing these every day, and you're doing them every day, but you're also going in to the doctor, not every single day. It depends on the person. Everybody gets a different protocol, they call it, because, your hormones fluctuate. So you go in to get monitoring, they call it, which is blood work. So you're also getting your blood drawn like every 3 days, every day. And then you'll have regular ultrasounds at the monitoring to check your follicles to see if they're growing in the right way, because that's how they know, okay, are the hormones that we prescribe Stacey working for her body? Are the
that's crazy.
Follicles growing? Yeah.
I didn't know that it was that specific to your individual body. That's crazy.
And then the goal is for the follicles to reach a specific size. And I think, and I'm looking at my notes, so it's like whatever, around 18 millimeters or something. And then after this monitoring process, once they get to the point where like, okay, her follicles are growing, they're at the right size, you'll then take another medication, which they call the trigger shot. And that's to tell your body, all right, this is time now for, these are mature eggs, for them to get them out. So then the egg retrieval, so that's like the ovulation trigger. The egg retrieval then happens, and it's about 36 hours after you have the trigger shot. So you go in. Fun fact that I learned, sometimes where you have your egg retrieval is not where you're going for monitoring. Put it posted on that because I learned that the day before I was supposed to go in. Thank you, doctor's office, for giving me details.
Oh my God.
And so you go in, the egg retrieval. This may sound fucked up, but again, high functioning brain over here. Best part of IVF so far for me, I fucking loved my egg retrieval day. You want to know why? It was a quick process, and everyone was great in there that day. I got anesthesia, and I love anesthesia because it made me sleep and take a nap. And when I came out of that, and I'll share the photos because I made Joe at the time, and it was funny. Like I was like, take pictures. We were taking pictures before we went in, and he has pictures of me coming out of it where the nurse is like, okay, it's time for you to wake up. And they're like telling you to walk around, they're kind of guided walking you. I have this like IV, and I have my eyes closed. I'm like, fuck you, bitch. Let me sleep. I want the anesthesia. It's not a ton. You know, it's like getting your wisdom teeth or something. It's not like I'm going in for an 8-hour surgery, but I'm like trying to let this every drop of that anesthesia stay in my body, to the point where Joe was like, you didn't even want to open your eyes. And I was coherent. I knew what was happening.
Yeah, it's like being woken up from a great sleep.
Yeah, I'm
Who the
like,
hell
let
wants
me
to do
be.
that?
I have to get back in the car. And we had like a 45-minute drive.
Why are they worried about you walking around? I don't understand.
It's protocol. You know how it is. They can't like release you
like, they
until
have
you
to make sure you function with the
Yeah, I'm
anesthesia.
I
like
can't
carry
move.
that bitch to the car.
Like,
Let her
get her in
fucking
the car,
relax.
dump her off. And I've heard this same thing from other girlfriends, sisters of mine, that they're like, oh my God, the anesthesia. And the interesting thing is, they too are like me, where I would say type A, high functioning women. And I only say that because IVF is not for the weak. And it's not only not for the weak, it's not for people. I'm not saying don't do this, but it's like, you got to be detail oriented.
Let's put it this way. It's for women for a reason. We make the babies for a reason.
Oh, no men would get through IVF. Jesus. No men. I mean, we know the birth control conversation, but literally, like, even if there was a birth control pill for men, there would be the same pregnancy rate, because no men would take that pill on time. No man would.
I'm dead. Or they'd be like, babe, I lost my pills again. Where are the pills?
Have you seen my pills?
You see my pills? Like, well,
Seriously.
babe, you asked me that yesterday. Did you not take it yesterday either? Don't worry about it, babe. Anyway.
But on that note, so anyway, so that's kind of the, like, in a very casual process of, that's the egg retrieval. Now, when I tell you, again, like we said earlier, like, yeah, I'm able-bodied, but I also pride myself, it's not even pride, I'm somebody that's like, let's fucking do it, let's just do it. And again, that's also because of, like, literally that's in my DNA. That's our grandmother on our mom's side, our white side, was disabled her entire life, and we never were like, she never said, and we never said grandma was disabled.
She wouldn't really acknowledge it that way at all.
Extreme pain her whole life. Terrible, terrible, terrible childhood arthritis.
Which also, looking back, I was like, okay, this is probably why, like, I've had such a hard time accepting.
Yes.
And like, because, you know, there's like a guilt
fight
to it.
through
but
it.
Again, I digress, but that is definitely something that we should talk about at some point, because while I appreciate and admire her strength, you know, there comes a point where you should be able to raise your hand and ask
I'm
for
not,
help.
Different
and all
times.
That. Different
I'm
times.
just kind of giving
no,
a little...
I
right.
Totally.
And so, but during the process, it's like, I was super, super grateful that I am not someone that doesn't use their voice, because if you can't speak up, you're going to have problems.
Yeah. So let's talk about that. Like, why I know that, you know, when we have talked just in our typical talking every day, that you were, you know, sharing some of this with me, where did the advocacy moments come up? Like, where, because it's hard when you don't go through IVF, like I have never done that, to understand, like, when there's these possibly difficult moments, which can happen with any doctor, but possible difficult moments that occurred for you. When did those occur? Like,
I
when
would
were
say
you?
the first day of the egg retrieval, my first appointment.
And so you mean the first appointment of the 2 weeks leading up to this is the retrieval
literally
date. So
day one. Like, I have day one, meaning I've come in for my first monitoring appointment. I've started drugs. And, well, one, I learned that I was never going to meet my doctor in person. So we had a 10-minute Zoom call, and that enraged me.
And let's be clear too, like, the doctor that is going to literally take the eggs out of your body.
Well, that's what I thought. But then I learned, oh, actually, that doctor says to me, oh, I actually don't do egg retrievals at the location that you're going to be doing yours at. And I was like, sorry?
So why were you talking to that doctor?
Exactly. And I would say that wasn't me. I did not learn that until, I'm jumping here a bit, but it was the day before my retrieval. And it just so happened that the nurse I had that day at monitoring, at the practice I went to, this is not every practice. Our sister had a completely different experience at her practice in New York that she went to, fertility clinic. Every day I saw a different blood tech that drew my blood and a different nurse for monitoring. I never saw my doctor in person. She never touched my body, took my pulse, nothing. In every single one of those interactions, whether it be a blood tech or the nurse, the only time at that fertility clinic anyone said, "Hi, how are you?" was at the front desk when I was checking in. So that means no one's asking you. You're taking all these drugs.
I was saying you're taking, so folks know, you're taking a bunch of drugs at home. Like there is a laundry list, pills, shots, injections.
And their times, you know, you have to be precise.
And so, yeah, your body is going to be fucked up. Like it's weird. We're saying it's weird that any doctor is not asking how are you, or any physician, nurse, whatever. But it's especially weird when they know that you are being just loaded with all of these things that are going to make you feel weird. And like, I'm just shocked that there's no affirmation for you as the patient of like, hey, do you feel like this, and this today? Okay, these are normal. These are not. Like,
yeah, no. And it wasn't even exactly, it was, no one ever asked me like, how are you doing with the medication? How are you feeling? Are you having any side effects? Do you have any rash, any headaches, any nausea? We know you have a hormonal disorder. Nada.
Well, and especially like on your chart, you're going to have hormonal disorder. You're going to have, and with the hormonal disorder and like the acne, which is related to, again, hormones, then you're going to have your migraines.
Yes.
Then your ADHD. Like they're not asking you about any of this.
Yeah. So also what they'll do after you go in for monitoring, later that day, the nurse that you get assigned a nurse, and the nurse that you're assigned to is supposed to call you and tell you, okay, Stacey, this is what happened at monitoring. You know, this is where you are, you know, follicle wise. So today you need to take this dosage of this medication or continue on with the same. You have to get instructions by that day. That's the whole point of it. And so then they'll send them, they're supposed to then send that in the patient portal. That was not happening for me.
So sorry, this is every single day leading up to the retrieval. Every day of the 2-week period leading up to the retrieval, you're supposed to talk to a nurse every day?
Every day, or so it's like at the beginning it's every 3 days. So like week 1, I think it's like every 3, and then the final week that you're in it, it's every day you're like getting monitoring.
Okay.
But basically anytime I go into the physical location of the clinic, I'm supposed to get
Which is every day.
Which is every 3 or then every day.
Yeah. Every day once you're in the 1 week window, you're physically going in there.
Right.
Okay.
You're going in there. And so I have a job. I'm on the phone a lot. I'm in meetings all day long. I can't always I would sometimes miss the call. I didn't know when the nurse was calling.
Yeah,
and no discredit about that.
Yeah.
But sometimes I couldn't even hear the voicemail, or she was talking very fast, or I wasn't getting details. I wasn't getting a report about how well I was progressing. And I didn't know what I didn't know. They didn't give me any, here's what you will receive. This is what will happen. I wasn't given, while they were giving me a protocol of what drugs to take, I wasn't given a protocol of this is what you can expect from your assigned nurse.
Oh.
So I just thought, okay, they're going to call and tell me these are the drugs to take that day. But they wouldn't put them in the fucking patient portal. I'm like, can you just email me this? So I also don't have to, literally, this is me. She's on the phone and I'm writing it down.
What?
And I'm like, Joe and I, thank God I have an amazing husband. Our whole thing was like, Joe was like, you have to physically go through all this. I will handle the mental load of what you have to take, when you have to take it, and I'll be giving the injections. I'm like, awesome, great. So, and I would say this to them, like, if you could just send this to me. Also, because my husband eventually would have to give a sperm sample to create the embryos, he also has a patient portal account with said fertility clinic. And every fucking time, because I did skip a spot where Joe also had to do a semen analysis. Every guy will have to do that too. And they would be messaging me, the woman, in my patient portal saying, oh, your husband needs to do this and that. And I said, okay, great.
Okay, so you're telling me when Joe had to go in or needed a note for his semen
analysis,
I was like, well, they're messaging you?
Yeah.
Like you're his fucking mom?
Yeah. And I was so pissed because one, you're already, I'm like, this is also just the topic everybody talks about, the mental load with women. I'm lucky I don't live in a relationship. I'm not in a relationship where I'm like, oh,
it is live, right? Like that is live in a relationship.
I don't live in a relationship.
Yeah. Anyway.
But I would say to Joe, like, hey, did the clinic did they send you a message about the semen analysis? And he'd be like, I didn't get anything in my email. And I would say back to them, can you email my husband? Because I'm not the one with the penis going in there. So riddle me this. Why are you reaching out to me? If it takes two, but already prior to there even being an embryo created, society, starting with this fertility clinic, is putting gender roles and the mental load on the woman that's going through all of this shit just to get pregnant.
Jesus Christ.
So
okay.
There's that.
So then, okay, because the reason that we got there was because
my nurse wasn't giving instructions.
They're not putting it into the portal.
They wouldn't put it in the portal.
I'm actually shocked. I'm not a doctor. I don't know how it goes. All I know is from having to see so many doctors. I know my rheumatologists are like required to have all this shit in the portal just for like insurance to like even. I'm just shocked that they're not even required to put it in the portal. So they're just like leaving you a voicemail?
And it wasn't, they also weren't, calling me, leaving a voicemail. And I was just like, I just thought, and the first time I thought that, okay, cool, I'm not maybe paying it, I'm taking my little notes, but cool, I'll get them more detailed in the portal. And then I'm like,
and then you're like, there's no portal.
And mind you, you're taking these hormones that I'm not as on it as I usually am. So then Joe would be like, okay, so what do I have to do today? And I'm like, let me check the portal. Fuck, thanks. I'm going to give a fake name. Thanks, Sheila. Fuck off. Like, so one, again, I don't know what I don't know. So I don't know if that's supposed to happen or not, or if that's just the clinic acting, that nurse acting as she's supposed to in her process, right? So that's when I first started to, before we even got to me being at the appointment, was already like, here we freaking go. I'm going to have to manage this. Then I go in for monitoring, which was, I remember telling Joe, I went in on my own just because I'm like thinking it's like a quick, I'm getting blood work. I don't need him there. And I was just spoken to like with such disregard when I asked questions in that appointment that day. And I think it was like I was having some symptoms of, that's what it was. I started to get like a yeast infection. And I didn't think it was a yeast infection. Like, if you have a vagina, you've had a yeast infection. Let's be adults, okay? It can be a fucking easy bake bread oven down there.
I'm dead.
But I was like, yo, this is not, like, my vagina felt like it was on fire. It was like fire ants, not like I'm having a lot of, like, TMI, but, like, discharge or anything.
Right,
I'm like, oh, God, is this me reacting to the hormones? Am I going to feel this way for the entirety? And they looked at me, they were dismissive. They weren't hearing me, and were kind of like, go take Monistat. If it doesn't work, that's something you see to your OB for.
So they didn't even, were they able to confirm or deny if that's a normal thing?
They told me, I asked, I think it is, but they were like, we don't do that here. We won't test you to see if we don't do cultures.
Wait, no, I'm saying, is it normal? Did they at least say yes or no? It's normal to feel like you have fire ants in your pussy during this process?
No, they didn't. There was nothing where and again, they didn't ask me how I'm doing. I said also, like, I'd interject. They're usually in and out. And again, this is not me talking smack on nurses. Our mom was a nurse her entire career, 38 years, whatever. We heard stories. We know staffing issues, blah, blah, blah. But our mother bedside manner is next level, so nurturing, questions that I'm like, I also know. This would be someone my mom would be like, the fuck?
Yeah.
So they were really dismissive of my symptoms. I'm like, okay, fine. I'll go get Monistat. Anybody who's had a yeast infection knows that's so annoying. You're literally shoving medicine up your vagina that then is like gross and it's coming out. So I was just hoping they could give me a script or something. And again, I didn't know if it was yeast infection. So I'm like, okay, I will go get Monistat because again, if you've had a yeast infection, you know this too. If you're trying to schedule an appointment with your OBGYN, it's usually gone and done by then. They're like, oh, we'll see you in 2 weeks. Crotch is on fire. No big. So I go home. It's getting worse. I'm so uncomfortable. I'm like, Joe, I don't know what to do. I seriously, like, I can't handle this. Again, I'm working and trying to handle that. And it was just making me feel crazy because I was feeling like I was being gaslit in a way. One, I thought, this is insane that all you guys do here is shove things up my vagina and you can't give me a culture here.
Yeah.
Like, that's wild that this is not part of your protocol. But whatever.
Well, especially because it's happening during this process. So wouldn't you want to know if like something was going on or you're having a reaction to the medication?
Exactly. I truthfully didn't know. I was assuming a yeast infection. I didn't know what was going on. And I thought like, God, am I allergic to something? Like,
right,
I don't know.
That's what I would be thinking.
And so Joe, that was the first appointment. And Joe is like, and I'm like crying to him because I was like, I feel awful. But also it was the way they were talking to me. And again, I don't have a problem speaking up for myself, but you're in the room. It's one other nurse. You see different nurse every day. They're quick. They're in, they're out. They don't say hello hardly or like, how are you feeling? How's it going? And mind you, in this monitoring appointment, when the nurse is coming in, I'm laying on a table with my legs spread. She's shoving a transvaginal ultrasound device, so it looks like a dildo, up my vagina. It's a vulnerable thing. Let's also not take into account, I've never even been asked about sexual trauma at any OB appointment, which is disgusting. And so after that first appointment, I tell Joe, of course, he's livid. And he's like, well, I'm not missing one. I'm coming to every single one. And I'm like, thank God. So next appointment, Joe comes in with me. My crotch is still on fire. I've done the Monistat thing.
And this is literally the next day.
Yeah, next day or within 3. Like, it's seriously.
Yeah. Okay.
And this time I'm like, I don't know what's going on. Like, it's so awful. And the nurse, Joe's face was like, are you fucking kidding me? She says again, we don't do that here. You're going to need to see your OB. Don't know what to tell you. He's like, she didn't say don't know what to tell you. She was like, we don't do that here. If it wasn't the Monistat, I was like, I just don't know. Is this normal? She's like, we don't do that here. We don't ministrate. You're going to need to see your OB. It was literally like she wasn't giving me anything. And I'm thinking in my mind,
you're like, why are you doing this to me?
I am one of the, I'm doing air quotes, lucky, because no one's lucky that you have to go through IVF. But I'm trying to put the glass half full on it that I have the privilege that I have health insurance that's covering this. Do you know how many women were sitting in that waiting room that were paying out of pocket? I would be like, fuck all the way off. I get better customer service from Comcast.
Yeah.
And so she says to me, you need to go see your gynecologist for this. And I'm like, again, thinking, great. I'm not going to be able to get an appointment at my gynecologist for this. This is not. Luckily, my gynecologist office is literally down the hall in the same building. And my gynecologist is the first gynecologist that I just like. I love her. She was the one that actually got me a diagnosis for PCOS. So I have trust. Mm-hmm. I walk into the gynecologist. We're like, fine, we're just going to follow suit. So Joe and I walk into the gynecologist's office and I go up to the desk and I say to the receptionist, hi, I'm a patient of, said fertility clinic, and they wanted me to come in because before I can even say my reason, I was trying to explain I'm here in person requesting an appointment because I'm literally down the hall. So I'm going to just ask. Woman cuts me off and is, we don't take any more OB appointments. We don't do prenatal. And I just can't. At this point, I'm tired. I feel miserable. I haven't been able to sleep because I feel like fire ants are on my vagina. And I just walk out of the office. I start crying. I start bawling and I walk out and I'm standing in front of the elevator bay. I just said, I can't do this. And Joe steps up to the desk and he goes, my wife is not pregnant. She was trying to explain to you that her fertility clinic wanted to come here because she's not feeling well. She's having some symptoms of the fertility medication, and they don't know if she has a yeast infection or something else. And they said they can't treat her, that she has to come here. Then the woman's like, oh. I mean, you're just like, fuck off, man.
And even if you were pregnant, I don't care what the fucking issue is.
Have some compassion.
Have some compassion. Why are you even in that field? And I say in that field because whether you are at the front desk, whether you're the person that's picking up, you know, the trash, you know, like I don't care what you're doing. When you have a job in healthcare and people are in such a vulnerable spot, why did you take, I would rather you be silent than speak to me like that.
Yeah. And look, I get, and again, just like I said earlier, I get it. Healthcare, like, look, I'm not, for many reasons, in the medical field, mainly my brain, but I have so much empathy and appreciation for our nurses, doctors, first responders, everybody. But you are in a medical field dealing with health, wellness, people's lives. I am not, and I cannot imagine, and I do have a huge customer service component to my job. I would never speak to a client like that. That has nothing to do with health. And the fact that you are so quick to snap at me, so quick to say no to me, so quick to not explain, not give me any information. And I'm there with my husband. Now, we started the process in 2021 of the diagnosing. In 2020, all these women were going in alone.
Yeah.
So you couldn't have an advocate in the room.
Yeah. I mean, that's such a great point that 2020, all these women were going in alone. Because that was a big piece of what I had like marked in my head, the advocacy piece that like you and I have talked about our personal connections of being so grateful for having husbands that are, one, having a partner there in the room, having someone that is like, you took the vow of sickness and health, like you're signing up. So I can't imagine if we're talking about a woman that 2020, you're just going into the room alone, or now in this moment, 2024, where you don't have a partner or you haven't. And so as a side note, whether it's a friend, anyone that you might feel comfortable enough with to have on this journey with you, that to me, from hearing from you, is having an advocate along your way that can just, or someone that is even just going to hold your hand and look at you and say, it's okay to speak up.
And like I said, every clinic is different. And like Lindsay, for example, our oldest sister, she went through IVF. And again, the practice she went to seemed like a world of a difference than mine. Yeah. But she started going through it in 2020. So she was alone in the room because her husband couldn't go in. Right. And I think, thank God, and I said that to her, thank God you went to that clinic.
Thank God.
Because the anxiety that you have.
Hers was, let's put it this way, like, and that's where, you know, DM us if you are in New York City and are curious, because I refer, or, you know, we could just talk about, you can find out for yourself. Follow
Dr. Lucky Shekhon.
Yeah, is that her handle? We'll like link it. We'll do it one of the things in one of the spots.
She's amazing on social.
Yeah,
as well.
And so you can just see right there in all of her information. Her
where she works is RMA.
Yes, RMA. But even just following her, if you're like just trying to dip your toe into.
And I did. I got. Thank God for technology in that regard that you can find, you know, community there. But yeah, as far as the biggest takeaway, you're right. Like I would say that like have an advocate for sure. Because you do need someone else to help you with the details, even if you are the most detail-oriented person. Like I said, most of the women I know that have gone through IVF are very type A, on the ball, entrepreneurs, boss women. And you got a lot on your plate already. Mm-hmm. And then hormones do fuck with you.
Yep.
And anybody that says like, oh, women, just like when you hear all these fucking loser, I'm not even going to go there, politics, but just say like, oh, women aren't fit. Please. We can juggle so much. This is a like unnecessary mental load that doesn't have to be there. That's why I was so frustrated with the clinic. It doesn't have to be there.
And that's what I was going to say. Okay, so like, because I'm sure other people are like, on the edge of their seat wanting to know what happened with the fire pussy. Like, so Joe says, my wife isn't pregnant. She's now out in the hall.
Yeah.
Fuck you. She's having a breakdown because we're just trying to get pregnant.
Yeah. This was at my OB office. And then the receptionist is like, oh shit, I'm in hot water. I just told someone trying to conceive that we don't deal with prenatal appointments, and got me an appointment in. And I saw my OB, who was mortified about the experience I had. And then I told her about the experience I had at the front desk. And I was like, I told her what the fertility clinic told me, and her jaw dropped. And she goes, Stacey, what? Like, I can't, I feel so dismissed there. And she's like, I've been referring people. And I was telling her about the lack of details and, you know, having to follow up and ask, please, can you send this in the portal? And also how many times I had to call and say, hey, this is not the correct pharmacy for me. I don't have my medication. Is it coming or not? Because the medication, if it's not on your doorstep, you are shit out of luck. And if you don't take that medication at the same time every day, because it's literally getting shipped to you, it doesn't just come from CVS. They're specialized pharmacies. So it has to be shipped.
Is it shipped and arriving that day? Because I'm, you know,
like the night before, and it's like, it has to be on ice, some of it, you know.
And so we're talking about still, this is just for the retrieval.
Just for the retrieval. So there's so many times I had to be on the phone. Literally, I had the same conversation. I said, oops, that's actually my insurance provider is X. I'm pretty sure they told me that I don't have a CVS specialty pharmacy. And they're like, nope, that's the pharmacy. I'm like, okay, I'm not looking in the back end of the system. What do I know? Then they're like, no, actually, it's not your pharmacy. It's this pharmacy. Call them and they should be able to deliver to you. I'm like, okay, called them. And they're like, yeah, you live in Maryland. This is not the pharmacy for you. And I'm like, get your shit together, clinic.
And that, again, to everything that you've been saying about it, this is already such a difficult time. And thinking about, and you know, and again, because you're a positive person, you're like, okay, well, I already went into this knowing I would need an IVF, but I'm thinking about the woman who has been trying now for 2 years. Now she's going down this IVF journey, and she's now having to worry, is my medication even going to be there? And because on top of that, this woman also doesn't have insurance. She saved up her money, and you are not triple checking. You're not putting things in the portal. I mean,
and every cycle counts. Like, yeah, you're not getting your, the other thing I will say too is not the egg retrieval, no matter if you're creating, if you're like, okay, I'm going all the way through IVF, maybe you're someone that's trying to like freeze your eggs.
Yeah.
Or maybe you're someone that just found out you have ovarian cancer, and you're freezing your eggs so that way you're preserving your fertility later on. So many things.
So many things.
You all aren't asking me.
And truthfully too, you again, I give you credit for, like, you know, always trying to put like glass half full and all of that. But like, you also just got diagnosed with PCOS, which said you have fertility issues, which said you're going to always have acne, which, you know, the list continues to go on.
Yeah, and it took me 12 years of fighting with doctors.
12 years of fighting with doctors to get the diagnosis. So like, the fact that you're sitting here and having to say, to continue the positivity, to continue your own positivity and being like, imagine the woman with ovarian cancer. It's like, that's where we really have to go as women to feel like validating the fucking situation that, oh, well, lucky for you, you like, I mean, fuck off. Like,
and again, I say, fuck you to politicians in Alabama who don't know your ass from your mouth and are actually fuck you to any politician talking about a woman's body. You don't know dick.
Yeah.
And so, you know, let's just think about a woman that maybe have gone through this whole process and then is told, like, sorry about your bad luck. You're in a cycle. Pause. We're changing legislation. So many fucked up things. And people need to just keep their own fucking minds, their own opinions out of other people's life choices and decisions. And so that, I say that to everybody, because there are some of you that I'm sure are watching this and maybe don't vote the way that I do. But think about everybody. Think about everybody when you vote, not just your own fucking selfish reasons.
Well, and I feel like this is such an easy thing to be connected to, because doesn't matter, you know, what religion you are, doesn't matter your race. if you want, or any of your friends want, or your sister or your cousin or your teacher or whomever wants to have a kid, we're talking about just like continuing the human race. This applies to you. And how can you not have empathy and sympathy?
Yeah. Just if you can just cough and get pregnant, great. But that doesn't mean you can say fuck you to every other woman, you know, or it's actually like saying fuck you to your kids because you don't know. I mean, our mom had 5 kids, no problem. It's not like she was going to know that 2 out of her 5 had PCOS and 3 out of the 5, you know, that you would only be able to have 1 child.
Yeah.
And so it's everything like that. And not to digress, I could rant about that all day. But yeah, so that was thank God I had my husband. Thank God I had an OBGYN and who was also a Black woman. And that's the other part of this. I haven't even mentioned race. But you can't help, because we've talked about this earlier on. Statistics don't lie. Just like science doesn't lie. When there is statistical evidence that Black women and women of color are not heard, not seen, are often ignored and medically gaslit, I had to question, is this because I'm being ignored because I'm a Black woman? And it's really sad and disgusting that I had to even think this way, but my Joe happens to be white. And I had to think, okay, well, if Joe's in the room and he's a white man, maybe they're going to treat me better.
Which they will, and I'm sure they did. Like, sadly.
And I can tell you, and we'll do it in another episode when we talk about further on in the process, but I can tell you about one specific nurse. It was a night and day treatment when I had to go another time by myself. And then how she treated me differently when Joe was in there. And it really gets you. But and the vagina thing ended up being that she was like, gave me some over-the-counter meds or whatever for the yeast infection. It was that, but she was like, this is like ridiculous that they couldn't help you, couldn't culture you, and even just were talking to you like that. And my OBGYN, or my OBGYN was like, I can't believe I've been referring so many patients to this clinic and nobody has told me this. And she's like, and I'm not saying it's not happened, but I go, that's my thing too. I'm using my voice because I have always been taught, and we said it in another episode, our grandpa always be like, speak up. Our parents taught us, would purposely not speak up at times when we were having, we were facing, and I'll just say discrimination in like sports in high school and things, because they wanted us to learn how to fight those battles to an extent. They stayed out of the conversation to an extent. And I said, because other women, 1, you don't know what you don't know.
This is exactly.
And 2, there is this, some women do feel shame, especially culturally. Different cultures, they're like, you can't get pregnant on your own. Or again, with religions, I'm no longer a practicing Catholic, but you should see these forums where women are like, hey, I'm a Catholic woman. What did your priest think about you doing IVF? And I'm like, what? Like, literally.
So, I mean, that makes a huge point, because you're talking about women. You're already in a vulnerable,
feel shame.
You're already in a vulnerable state just because of the fact that you even have to consider IVF. And then when you add on top of it, where you come from and what you've been taught and the environment that you're surrounded by. And just sometimes you're tired and you're like, you know what? I don't even want to fucking tell the OBGYN that I had a shit experience, because it's one less thing on my list and I know it's probably not going to do a goddamn thing. And so you do get tired. And you are just like, you know what? I want to throw my hands up. And I just want to get through these 2 weeks and I want to forget about it until, I'm going back for the retrieval. And I mean, we will continue to talk and talk about this, because obviously it's an entire journey.
There's way more to the retrieval.
Yeah, there's way more to the retrieval. There's, more to just your entire journey throughout this. But I guess before, I feel like I was kind of wrapping up, but like, do you feel like there's something else that you want to talk about today with the retrieval?
No, I don't think. I think that's a good place to stop with this phase of the retrieval, because next you'll hear about how I really go in on the clinic, and that I think we'll save another day. But I think the biggest takeaway from this lesson is, 1, you're not alone. 2, there's no shame in it. 3, having a baby via IVF is natural. Okay. And 4 is do have an advocate. And if you're not comfortable, like literally during that time, if I didn't want to do anything, during that time, the only thing I did was what I wanted to do. Joe cooked, he cleaned, does that anyway. It's not like it was during that time. We are millennials living in 2024. But
he was taking it all on.
He was taking it on, and he wasn't just taking it on. He was there hearing me, being empathetic. He also, I mean, you can see Morgan's curls look great. He got me a beautiful Dyson as my fertility gift.
Honestly,
I did not ask for anything. It was the nicest. I would not have bought for myself, but shit like that. He was so focused on my self-care and doing things for me that I wouldn't have done for myself.
Yeah.
And so like having that solid partnership, but also if you are that type A woman, let your partner in. You cannot take this on.
Yeah, and don't do that to yourself. If you're asking for advice, which you don't have to take it, but if you're asking and you want to take it, I think that's the biggest thing that I've learned from you from this. To anyone that are around me is going to go through IVF or want to freeze their eggs, is advocate for yourself throughout the process, because literally throughout your entire process, there has been so much random shit that has come up, and just thinking about the person that has always had a really difficult time raising their hand, speaking up for themselves. Like then next thing you know, you totally fucked up your retrieval, or because you didn't take the medication that you were like, maybe it wasn't supposed to show on the doorstep. You know what? They know what they're doing. I'm not going to push them on it. Like, and I hate to say that, like, you have to stand up for yourself, because in a moment in time when it's already so stressful, all I wish was that it was just like a cakewalk, for these women, and you're barely even having to think.
Right.
But like, that's just unfortunately not the case.
Yeah. And it is also like, sharing is caring. Everyone's different. I do think, I've said this before, vulnerability is a true sign of strength. If I hadn't been vulnerable about my journey, I wouldn't have been connected with some of my other girlfriends that I had worked with and things that had gone through IVF. I had some of my closest friends from college and my sister that were amazing with telling me, but you got to crowdsource.
Yeah.
Every situation is different. And those women, my friends from my job at the time or previous job, because I told them about my journey, they also had gone to a clinic that I had gone to. So I was able to say, hey, am I crazy? And they were like, do lean in to your type A-ness. And if you go with your gut, if you think something's off or you think something should be better, say something, even if they're operating the clinic as they're intended to. Speaking up and saying, this is fucked up, you can do better. It's going to help the next woman. So that was always my thing. Like, say something to help somebody else.
Yeah, absolutely. Oh my gosh.
So with that, whoo!
Actually, one last question though, because I do want to make sure in this part of it, we're using the Maven app.
Oh my God. I can't. Yeah. I started using Maven when these issues started arising.
Yeah, because if you've listened to the other episode, so that's why I know that Stacey's had to use this app because of like PCOS, yada yada.
It is amazing.
But so you discovered it during which part?
I am, again, my employer benefits. Man, I will never take for granted, because I've been someone that didn't have benefits at my job. They also that's my work pays for me to have access to this app. That is, you log in, you create your profile. It's for reproductive health. So it's different stages of the fertility journey, everywhere from I'm trying to conceive, I'm thinking about conceiving, to postpartum. Okay. I think you can be on the app until you're like almost 2 years, like to your kid's 2 years old.
I actually thought it was just for IVF. So this is just
no.
Oh, so cool.
They tailor your journey, and then give you a group of specialists like assigned to you, but you can, it's kind of like a Tinder situation. They give you one
and move on.
Yeah. And, I could talk to reproductive endocrinologists and reproductive nurse and holistic. So it's kind of also like if there's a flavor for everybody. If you're like, oh, I really want to talk to someone that's a little bit more Eastern medicine leaning or whatever, or I need to talk to someone that's maybe at a clinic, not the one I'm working on, to know that I'm not insane. And that was so validating, because I had some amazing reproductive nurses that jaws dropped when I told them how the clinic was communicating with me or how they weren't communicating with me. And they were like, that's insane. And these were nurses that were located in New York City and Seattle and Houston. So it was validating.
Thank God. Okay, so that's awesome that you were using it already.
Maven app. I do not know. I would hope you could get it on your own privately. I don't know how much it costs or anything, but it is something. Everybody go to your HR and ask for the Maven app.
Yeah, which is another thing too. If you haven't listened to other episodes where we talk about, because I sit within HR my career, I am not an HR expert because I'm a recruiter. I don't need to know any of the SHRM stuff. But from working with all the HR professionals, I do know that some of that's just like up to the person who runs benefits. Like if they don't know about it, you just you can ask. I'm not saying that they're going to give it to you, but it doesn't hurt to say, how much would this cost? Right. Or, if they don't want to pay for it, can they get some sort of discounted thing for you all? If someone does need it, it only costs you X rather than $200 a year. Maybe it's $100.
Because again, I was lucky to have some friends that were able to guide me and stuff. But even my therapist said, you're so lucky that you've gone through that you have friends that are willing to help and that have gone through this, because a lot of the women I talk to, they do feel completely alone.
And I've heard that too, because I've heard that they feel completely alone because of just everything that you've just said and not having the friends or the siblings that have gone through it, but also because of there's kind of like an unwritten shame that society has put on the miscarriage thing and not getting pregnant, because it's almost like if you decide to tell people that you get pregnant and you're not beyond that, 12-week window, it's almost like there's supposed to be this thing where like no one's supposed to know what to say to you. And that should be another part of the series, truthfully, totally. Because that's something in itself that's like, I don't even understand, because so many women experience that. Like, why do we even allow for there to be shame? If anything, we should just allow for it to be understanding that it's painful, understanding that it's hard. And just because other people have gone through it doesn't mean that it's easy. So, again, like I said, because we could go on and on about that, but I think it's all encompassing within the topic. So, but that's awesome. That's why I want to ask about the Maven app though.
Yes, Maven.
Glad to know that. But I think this is a good place to wrap it up. More to come with the second part of this series. We'll go all the way through the retrieval, because it is a wild story of how Stacey really ends up having to fully face-to-face give like a TED talk to this goddamn clinic. So we'll talk about that later.
And as we wrap, I just want to say, don't forget, one, if you have any questions, do DM me, DM us. If you are a woman out there that doesn't feel like you are alone, or you are, I shouldn't even say women, men, because there's, being a partner, all of that. Like, let us know if you have any questions or you need anything. And don't forget to like us, follow us, review us on Apple, Spotify, wherever you get your podcasts.
It helps us so much.
We love you all. And that's it for today.
Divas.
Do it for the story.
DIFTS.